Assalamu alaikum wa rahmatullahi wa barakatuhu. May peace and blessings of Allah subhanahu wa ta'ala the Almighty be with you all. Once again, welcome to your program Healthy Check, a program where we discuss healthy issues, a program where you're given medical advice from our experts, a program where you're advised in all aspects of health aspects. And with me today is Dr. Chibugo Hamidu, an expert or a dentist who is going to take us through our topic of discussion today, which is toothache. Actually, it is a continuation of the previous episode. And Doctor, or my brother, I'm going to ask you to say some greetings to our viewer.
Yeah, viewers, assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Esteemed viewer, it won't be Hamidu Chibugo alone. We have a public health worker out there who will join us later on in the course of the program, and he's Mr. Okrut, inshallah. Allah willing, he will join us briefly. Mr. Chibugo Hamid, before we go straight to the question, which I would like you to enlighten more about our viewer what a toothache really is, let me go out to our correspondent Mugisha to let us know the views of our viewers. What is their take on what a toothache is? Mugisha, I'm going to ask you to let us know what are the views of our viewers out there. What do they think, and what is their experience of the toothaches?
Thank you very much, the moderator. Right now, I'm at YMCA campus, as you can see all around here. Basically, we would like to hear about the people's views about the topic of discussion today. And as I'm walking around, being joined by another gentleman here, I'm trying to come nearer to him to get his view about people who are being disturbed by tooth problem, toothache, tooth pain. Sir, good afternoon.
Well, how are you?
My name is Umar. What is your name, sir?
Jaramogi Maiko.
Okay.
Yeah.
Yeah, we have cases of people who are being disturbed by tooth, they get tooth pain. What do you have to say about that disease? Is it common around your place?
It's obvious it's common. When I am talking now, I want to have a pain from the teeth.
Oh.
I try to go and cement it, but I fail to get healed about that toothpaste.
So you tried to go for cementing the tooth, but still it failed?
Still it's pain now up to now, and I want to remove it once.
You want to remove it?
I didn't recover it since I cemented it.
What advice would you give to some other person there who is going through the pain you are going through right now?
So far, when you're already pain for so long, the medicine which I give, because they say that you have to brush your teeth. Normally I use mine, even I use even the petrol for brushing my teeth.
Yes.
I fail to recover. I go to the hospital, they seal it. I fail to recover because once I eat, that thing comes out slowly. So now, remaining a hole when the cement is over.
Oh.
So now the pain starts coming back again. That's why I decided to remove it.
Yeah. I think it is the best option to go for removing it.
Yeah, that's the thing what I've seen.
Yeah, thank you very much for your time.
You're welcome.
Yeah, thank you very much. That has been our views from people we have tried to engage with. I will turn to the studio, to the moderator, to push us to another discussion.
Well, that is our correspondent there for you. Thanks a lot, Brother Mugisha. Thanks a lot, our viewer out there. Thanks for keeping it always MTA. Mr. Chibugo,
Yes, please.
you've heard them, you've heard him, you've had the experience, you've heard what he's going through. Actually, according to what I've heard from him, he's actually having the same problem, even as he was speaking. I would like you to enlighten more. For those viewers out there, maybe who have not got this experience of toothaches, what it really is to have a toothache, and what could be the causes of this?
Thank you so much. As you introduced earlier before, this is a continuation of what we
had discussed in the previous episode. Exactly.
That interview shows you how rampant this problem is in our communities.
Exactly.
He just picked someone at random and you told him, even now, I have a toothache. So it's the leading cause of suffering of all the oral diseases. So we said that toothache, it comes when the innermost part of our tooth is affected, which is the pulp.
Okay.
If at all any damage goes direct to the pulp, let's say a hole has formed in the tooth and it has encroached on the pulp, you'll definitely get the pain. Now, he's talking of cementing the tooth and still paining. Another aspect I had that the cement that was put there keeps on coming out. All those, they are common complaints among our patients. But if at all you cement a tooth and it's still paining, that means it was given a wrong treatment. If at all the hole is in the pulp, we discussed it about the treatments. Among the treatments we talked about was a root canal treatment. Let him go and have a root canal done, other than removing the tooth. Back to the question you asked me, what are the causes? There are several causes. Last time we talked more about holes in teeth. Okay. That a hole forms, it progresses from the enamel, dentin to the pulp. Now when it reaches the pulp, of course you have to get pain. And it's the most common one. Many of patients that come complaining of toothaches in our facilities, they have holes in teeth. But doesn't necessarily mean that it is the only sole cause of toothache.
Sure.
The second cause we can talk about, when a tooth is growing, most so the third molars, or those ones called the wisdom teeth, they push through gum. Now, sometimes the gum remains partially covering the crown. Now, that case is called pericoronitis. Now, in pericoronitis, we are seeing a tooth growing, but partially being covered by gum. Now, beneath that gum, food starts packing there. When food packs there, we find that there is proliferation or growth of microorganisms there, and an infection sets in there. Pericoronitis, peri is above, coronitis, crown. So above the crown, a gum is covering. Where food gets impacted, is acted on by microorganisms, bacteria and other oral microorganisms, and an infection sets in. You'll find someone even swelling, pus forming there, okay? So either pus forms, or if at all a tooth is growing up, it will traumatize this gum that is above the crown. So that's another cause of tooth pain. Someone will come complaining of tooth pain, but when you check, you will find it's actually the gum covering the wisdom tooth that is growing. So there, you just go to the clinic and it can easily be worked on. Either we remove the tooth or we excise off that flap and you'll get fine.
Okay.
Another cause that we can talk about, very many people, someone can come and tell you that I have a toothache, but I don't know where it is. Now, some causes are not on the tooth itself. Now, we have air spaces called sinuses in our bones. Now, above the upper molars, between the premolars and molars, there is an air space that is there called the sinus. Now, when you go into stuffy places, maybe when you have flu, those air spaces might get, they have openings to the nose. So they keep on draining draining. Now, when you go into stuffy places or when you catch a flu, those openings called ostia, they can be blocked. Now, when they get blocked, these sinuses will no longer be draining.
Okay.
So, inside the sinuses, you'll pick an infection. When you pick an infection, since they are directly above the teeth, it will manifest as a toothache. Someone will come and tell you, my teeth are painful. I cannot even join the teeth. So by so doing, for them, our viewers or the patients will call it a toothache. But it will be after going to the facility, you have an examination done, they find no teeth having any problem, everything is normal, then there are some tests that we can do. When you palpate around these areas, you can easily feel pain. If at all the patient is a Muslim, whenever they go into ruku, when you're praying, whenever you
prostrate,
yes, if you bow down, you feel a lot of pressure and pain. So those are the cardinal signs of sinusitis. Even they still sometimes they get even a stiff neck. When you turning, can become difficult. So there we don't extract a tooth. So this one, let me make this disclaimer that not only that any pain you get of a tooth will warrant you losing a tooth.
Oh.
It's a common narrative in our communities that whenever you have a toothache, you have to remove it. So if at all, for such reasons, you don't need to remove a tooth. We just prescribe some decongestants, some even local. You just, when the sinuses start draining, the pain or the symptoms will disappear.
Okay.
Another cause of pain or toothache, it can come at the terminal stage of periodontal disease. In one of our episodes, we talked about the gum diseases.
Yeah.
Now, pain comes in those gum diseases. Pain comes at the terminal end. That I remember telling our viewers that the periodontal diseases, for them, go with the entire tooth. So a patient comes with a lot of pain. A tooth is very mobile, but having a lot of pain. So at the terminal stage, we normally get severe pain. You cannot even join on the tooth. So in that case, still a patient will come and complain of toothache, not originating from a hole in the tooth, but because the tooth has lost the supporting structures. Now, in our day-to-day life, you might get trauma or a damage to a tooth. Now, damages to our teeth differ. You can have a damage that extends only to enamel. You won't get any problem. Someone just a chipped tooth, but you won't get any discomfort. Oh. Now, for any trauma that extends to the dentin, you'll get sensitivities. But for any trauma that extends to the pulp, actually you'll get pain.
Sure.
So, trauma is also another cause. Other than decay, there is not decay, but it's another cause that since the fracture line or the fracture extends to the pulp, wherever it is irritated, you have to get that severe toothache. So still trauma comes or tooth fractures, they pose another problem to toothache. Another thing is very many people not actually many, but a sizable number, normally if you don't follow well the post-operative instructions, you normally tend to get pain post-treatment.
Oh.
When we remove a tooth, 3 days to a week, someone can experience a bad ache. Some people even reach at an extent of thinking that a wrong treatment was done. Maybe a wrong tooth was removed. Yeah. So it's called a dry socket. That when you remove, we shall get a full episode about a dry socket, because it's also a common occurrence. Okay. That if at all the wound gets infected and the bone doesn't heal, it will pose the same symptoms you felt, even more. By the way, pain as a result of a dry socket is worse than a toothache itself.
Sure.
So very many people come complaining of toothache immediately after an extraction. That's within 3 days to 1 week, and it's really bad. Okay, so they complain that maybe another tooth was removed, but it's not. It's only the socket that is being infected. So there we just have to clean the wound again, initiate fresh bleeding, and you'll get fine.
And that is how rageous and that is how rampant or destructive toothaches are. I would advise you, in the line of our brother who advised us last time in the previous episodes, that even before you experience any toothaches, you should at least visit your dentist twice a year. I hope I'm in line with what you advised us. Right now, I'm going to, like I promised you earlier in the program, that we're going to have an expert or external expert, a public health worker, Mr. Okrut. You've been following us since the beginning of the program. I would like you to join in, inshallah, to let our viewers know what really it is, through your experience, of course, what it really means to have a toothache and what advice you would give to them.
I want to take this great chance to thank the people behind all this opportunity granted unto me, especially the host of the program, for inviting me and allowing me to share my few views with the audience and the people who are watching us. My name is Martin Okrut. I work as a public servant in the part of dentistry. At this time, allow me to give just a few remarks generally about toothache. One, like toothache is just any pain around the tooth. So at times what people should get aware of, if you get any discomfort, whether the teeth itself or the gums, please make sure that you see a dentist as early as possible, because some people wait until when it is worse, that the pain is always too much, like they cannot sleep. That's when they tend to rush to go and see a dentist. But in general, like visiting a dentist, whenever you get any discomfort around you, or you can make an appointment with the dentist, that is the best thing like we can do to always make sure that you don't wait for the long complications of toothaches. Because toothaches as well has long complications, like the gum getting so painful, and then also the swelling. So when you wait until it results into a swelling, that one becomes very, very hard for you and challenging. So visiting a dentist remains the main point as to why you should always make it a point, or should make it like a must. And then like the other thing is always, there's some other people generally at home there, you can be there and then you get toothache, but maybe the dentist is far, and you ask yourself, what can I do? Like to at least do away with this small pain for a short time. One thing is, in case you get any toothache when you're far from a dentist, or you are unable to reach to a dentist, what you can do simply is to just get warm salt water, you do the rinsing, and then the other is you just get there's some other remedies we always recommend, like taking painkillers plus some antibiotics, and then also like there are some things you can use like garlic. Garlic sometimes it helps in a way that it is antibacterial, so it helps. So some are reduced on the quantity of the microorganisms which are inside your tooth. So when you at least get one, you like chew it a little bit, and then after you can brush, it can help. And then some other things like can get like guava leaves, things like mapera, like in our local language, like they call it mapera. So you just get those leaves, you chew them also, or you can crush them, and then you boil, and after you use that water for rinsing your mouth, can also help somehow. And then things like clove oil. Clove oil is also important. Like you buy a smoker bottle, then you use like 2 drops or 3. You add in some other oil like sunflower oil, and you rinse. It can also help somehow in preventing toothaches. But visiting a dentist is always recommended to be done at least twice in a year. That is 6 months. At least that one can help. In case of any starting cavity or any starting hole on the tooth, the dentist is able to advise you on what to do. Or in case of any sensitivity or your gums are somehow like inflamed, he can advise you on what to do so that they don't go ahead to cause toothache.
Brother Chivugo Hamid, at this moment, just as you've heard from our brother, we're not going to repeat what he's just said. I would like, I've seen you've come with a lot of material here. I would like you to demonstrate. Maybe I might be sitting here not knowing how to use a toothbrush.
So, our dear viewers, as we said the previous time, that you only have 2 tools,
okay,
as preventive in the prevention of all the dental or oral health issues. You have 2 tools that you can use.
Okay.
Maybe another thing is visiting a dentist, but this tool here, a toothbrush, is one of them. If you use it well, you'll get peace.
Okay.
If you misuse it, you frequent our
So it
facilities.
can be a tool to help you prevent toothaches, and at the same time, it can be a weapon. I mean, what should I term it?
It can't be a weapon, but a knife. When you use it well, it helps you. If you don't use it, it won't help you. Okay? But this one, it's not like a knife that it can hurt, but anyway, at a lesser extent. For anyone to be free of oral health diseases should brush well. Not brushing, quote me well, brushing well. Now, what do we entail? What does brushing well entail? One, when to brush, we said every time we eat something, we have to brush.
After any meal.
Yes, since it's not possible to move around with a toothbrush, at least we restrict it to how often, that is twice brushing a day. Yeah.
In the morning after breakfast and
yes,
at night after supper.
Now, how do you brush? There are various methods or techniques of brushing, but some have been found to be detrimental to our teeth. Very many people like this to and fro. If at all you interview most of the people, they tell you, get a toothbrush, put it on the teeth, then I start.
Yeah, that's what we normally do.
Now, after some time, we find these corner teeth being cut. Even so, because we used to see them in books, that someone can cut a tooth. This brush can cut a tooth, even to the extent that the pulp gets exposed. I saw it.
True, yeah.
With my eyes. So a toothbrush can actually cut your tooth. So this to and fro method is being discouraged these days, since it can easily cut. Gradually it cuts or it damages the tooth itself. So for any brushing movement or stroke, a toothbrush or these bristles have to start when they are aligned parallel with the long axis of the tooth. After, you have to orient them to an angle, just to make an angle. Align,
Exactly.
orient. To make an angle of not 90, but half of that, which is 45.
Okay.
Okay? So align, orient. Align, orient.
Okay.
Then you make a movement. There are 2 encouraged techniques. Some of those ones we most encourage is you be as if you are sweeping.
You wipe it down. That is for the upper. Okay.
For all, even down. It's
For the
same.
down, you wipe it up. For the upper, you wipe it down.
Yes.
Okay.
But the most easy one is you align, orient, then make small circles. So you should be systematic, not to miss out any surface. So we start from the outer surface,
okay,
inner surface, still you align, orient, okay? Make small circles. We go...
The same that happens,
yes,
the upper part of your jaws, then should the same happen to the lower
inside,
part of
then
your
you
teeth.
go down, inside. Where you should not forget is this, even
The
if you
top.
just scrub the top surfaces, okay? After that, as we said, you rinse with only water. After the second, you brush again the second time, you apply paste, then you brush in the same way. Don't forget your tongue, okay? So what do we use when brushing? Unless we have to use fluoridated toothpaste.
Yes,
Toothpaste that has that element of fluoride.
Yes, please.
So that's the last question. With what you use toothpaste that contains fluorides.
Okay.
So that has been brushing. Now the second tool, as I told you, is a dental floss. It's just a simple thread that we use to clean in between teeth. It has this metallic part inside. It's the one that cuts it easily.
It's as simple as that?
Yes. So as I told you, we use our fingers. Even this side, you do the same. Okay? So after making this, you move it, use it in your mouth with your fingers, depending where you want to use it. Down, okay? Up, posterior teeth, you might, okay? So we intend, as I told you, is in between teeth cleaning, okay? You slide it, okay? So it can easily help in cleaning because a toothbrush can't go in between these surfaces.
Okay.
Okay, yeah. So it's only this thread that can slide within to remove the foods. Then secondly, this one is the one we recommend instead of toothpicks. Yeah.
Okay, so that is it from him for this program, and that is because of time. Like I've always been telling you, we're never good allies with time. What we manage, we deliver to you, and what Allah subhanahu wa ta'ala has helped us with, we deliver to you as well. So I remain your host, Nambale Bashir, today till we meet, inshallah, next time. Assalamu alaikum wa rahmatullahi wa barakatuh.